Well, hello, anatomy students. Mrs. Shelton here, and I just want to take a little bit of time to go over our Chapter 13 Cardiovascular System with you. Just making sure we go over some of the main points and also to make sure that you have some of the main information that you're going to need in order to be able to complete your reading guide. Now, also remember that Chapter 12 and Chapter 13 are combined. So Chapter 12 is just addressing blood and the components of blood, and then chapter 13 is talking about the cardiovascular system and making sure we understand how the cardiovascular system now transports that blood to all parts of your body. So, really, what we're going to be talking about in chapter 13 is making sure that we understand the heart that's going to keep the blood moving and also the different blood vessels. And then on top of that, we're going to finish up discussing about heart disease, understanding that heart disease is the number one killer in the United States, with a fourth of all deaths in the United States attributed to heart disease, cardiovascular disorders, etc. And most of those are preventable. So we need to make sure that we are addressing that and you're taking the steps now to make sure that you are maintaining good heart health throughout the rest of your life. Now, for chapter 13, um, we talked about just briefly already, we talked about the fact that your cardiovascular system consists of your heart and blood vessels. Now, when it comes to blood vessels, the blood vessels that we are talking about are your arteries, your capillaries, and your veins. Now, when we do talk about arteries, basic thing we should understand when we classify a blood vessel as an artery, it's carrying blood away from the heart. It's under a lot more pressure because the heart is pumping that blood out under a tremendous force. So arteries are thicker and they are carrying blood, the smaller arteries called arterioles, and it's at the capillaries. And we have capillary beds that are in our alveoli. So that's in our pulmonary circuit. And then also we have capillary beds that are in our systemic circuit. That's all the organs in your body. And at the capillaries, this is where all the nutrients and oxygen that your blood is carrying now can diffuse and make it to all the cells in the body. Now, this is also the capillaries where waste products get picked back up and blood now returns to the heart through small veins called venules and then ultimately through larger veins and then back to the heart again. Now, in this diagram, and the diagrams you're going to see diagrams where it looks like blood is either red or blue. Please, please, please. Your blood is red. Your blood is always red. Your blood is not blue. Don't look at your veins and go, oh, but look, they look blue through here. That's just because of the way light responds. Now, it is true that there's varying colors of red. Your blood, when it is oxygen rich, is actually a very bright red because of all the oxygen attached to the hemoglobin. And when your blood is oxygen poor, it's more of a maroon color, so it's a little bit darker in appearance. But the coloration here that you're going to see throughout diagrams is just to help you to determine where is my oxygen rich blood, where is my oxygen poor blood. Doesn't mean there's no oxygen in this, it's just oxygen poor. But they're trying to give you that color determination. So if you had an elementary school teacher that told you that your blood is blue inside your blood vessels, but it turns red once it hits oxygen, think about that. That's the dumbest explanation ever because the entire purpose of your blood is to transport oxygen and it is always 100% in contact with oxygen. So your blood is red. Keep that in mind. Now, this diagram that you are seeing here, this is an important diagram to make sure that we understand, and this relationship between the heart and the major blood vessels that go in and out of the heart. Now, your heart is making sure that your blood is under constant movement, and we're constantly delivering oxygen-rich, nutrient-rich blood to all the tissues in your body. Now, it is actually a four-chambered heart, and your cardiovascular system often gets referred to as a circulatory system because this blood just is constantly just going in this constant flow, this loop. Now, your heart has four chambers. We're going to talk about that. There are two major veins that enter into the heart, and there's two major arteries that leave the heart that we'll have to make sure that we understand. But your heart is actually divided into a right side and a left side. Now, the right side of the heart, and every diagram you see of the heart is going to be an anatomical position. And so, being in an anatomical position, we are looking at your patient's right side, and your patient's left side is what we're looking at. The job of the right side of the heart is actually to collect oxygen poor blood from the body and then pump that oxygen poor blood to the lungs. And that's what we're seeing over here is we are seeing what's referred to as the pulmonary circuit. And in the pulmonary circuit, this is going to be capillaries, these small little tiny blood vessels that interact with alveoli. Alveoli in your lungs are those tiny little air sacs. And based on diffusion, because if I breathe in a high concentration of oxygen, and now I've got my capillaries that have oxygen poor blood, well, carbon dioxide is going to diffuse into my alveoli, oxygen is going to diffuse into my blood, and this is actually how we exchange oxygen and carbon dioxide with the environment, is through the alveoli of the capillaries. Now, through this right side of the heart, through the right side of the heart, this is an atria. Atria collect blood, and ventricles are going to pump blood. This, being the pulmonary circuit, makes this easy to understand that this is called the pulmonary artery. Now, pulmonary artery, remember, arteries carry blood away from the heart. This pulmonary artery is the artery that is carrying blood to the pulmonary circuit, to your lungs. Now, coming back, now that I have oxygen-rich blood, blood is going to return back through the heart through the pulmonary vein. And now that I have oxygen-rich blood, the left side of my heart is going to collect that blood and now pump that blood out to my body. Now it's ventricles that are responsible for pumping blood, and they're going to push that blood out and out through the aorta. The aorta is your largest artery in your body, carries oxygen-rich blood. That's going to go down to arterioles and then down to capillaries, and it's at the capillaries in the systemic circuit. Systemic is now all the systems of your body. This is where oxygen is now going to be delivered to all the cells of your body so they can perform aerobic respiration. And this is also now where your cells are going to get rid of carbon dioxide, and your blood's going to pick up and dissolve that carbon dioxide back in it so it can return it back to the right side of the heart. The right side of the heart can pump it to the lungs, and we can exhale out carbon dioxide, and we can get oxygen diffused into the blood. And then that blood's going to go back to the left side. The left side is now going to pump that blood to the systemic circuit, where now oxygen gets to all the tissue of your body, and then oxygen poor blood, and it just cycles again and again and again and again. Now, when we take a closer look at your heart, we should know that your heart sits dead center in the middle of your chest. It is not over here where, we pledge allegiance. We should actually be dead center in the middle of your heart. Your heart, though, is an odd shape to it, and the left side of your heart is actually bigger. It's got thicker walls. The apex of your heart actually leans a little bit more to the left side. And then also your aorta, this largest artery of your body, actually curves over to the left side too. So your heart is dead center in the middle of your chest. However, there's a little bit more heart over on the left side of your body if we drew a center line and divided it. And then we can also hear this pulsing of blood coming through the aorta that also just curves around to the left side too. But understand basic location. Now your heart is also surrounded by its own covering. So this membrane surrounds it and keeps it protected. And so this is referred to as the pericardium. So make sure we understand that's what you're seeing dissected away here is this pericardium away from the heart. Now, when we're talking about the heart being cardiac muscle, so we've talked about those different tissues, this cardiac muscle that has to continuously contract and relax for at least 60 times per minute for every minute of your entire life needs a constant supply of oxygen and nutrients. So the main blood vessel systems that supply these walls of your heart are referred to as the coronary blood vessels. So this coronary artery, coronary vein. So this actually has a direct connection with the aorta that is going to now fuel this cardiac muscle so it can maintain that high amount of energy requirement. Now, this diagram that you are seeing, you are absolutely positively going to need to know this diagram for the test. Now, not everything. We've highlighted for you the things that you absolutely need to know for the test. Now, first and foremost, you absolutely need to know the 4 chambers of the heart. Now, again, this is a heart that is in anatomical position, and this is the heart diagram that you're going to see on the test. It's been dissected away so you can actually see inside to see the 4 chambers of the heart and understand those divisions. Now, we can see this midline here, the septum. The septum is actually what is separating the right side of the heart from the left side of the heart. Remember, the right side of the heart, its job is to collect oxygen poor blood, and pump that blood to the lungs. The left side of the heart is to receive oxygen-rich blood and to pump that blood out to the systemic circuit, out to the body, out through the aorta. So going with this cycle, blood is actually going to come from the body. Oxygen-poor blood returns to the heart through the largest vein in your body called the vena cava. There's actually two branches, the superior that's on the top and the inferior on the bottom. And so that oxygen-poor blood under very, very low pressure, veins have very, very low pressure to them, blood is going to get collected here in the right atrium. These are very thin-walled chambers at the top of the heart, and that really is the atria's job, is to collect blood from veins. Now, from the right atria, blood is actually going to pass through this valve here. This valve is called a tricuspid valve. Well, this tricuspid valve, it's an AV valve, it's an atrioventricular valve. This valve is going to be open when the atria contract in order to squish the blood down into the ventricle. Now, ventricle's job, and this is what the majority of your heart is actually just the thick walls of ventricles. Because what will happen is ventricles are going to contract, and when ventricles contract, they're going to push blood up and out through the arteries. Now, when they contract, they actually close off these valves. So you see here the tricuspid valve. When the right ventricle contracts, and the right ventricle is going to contract at the exact same time as the left ventricle. And these AV valves are actually going to get pulled closed, and so blood only has one option, but to get pushed out through the arteries, so it doesn't go backwards. So valves throughout the cardiovascular system are actually designed in order to make sure that blood flow is only going one direction, always. Now, from the right ventricle, blood is going to go out through the pulmonary artery. Now, the front of the pulmonary artery is actually cut off, but here's my pulmonary artery is what I am looking at. The pulmonary artery is actually going to be branching two different directions because I have two sides of my lungs as well. But this pulmonary artery is now going to take that oxygen-poor blood. This is the only artery in our body that carries oxygen-poor blood. It's going to carry that oxygen-poor blood to the lungs. At the lungs, this is where carbon dioxide and oxygen exchange is going to happen. And what's going to now happen is my blood is now going to be oxygen-rich, and it's going to return back to the heart through the pulmonary veins. Remember, veins return blood back to the heart. Now, through the pulmonary veins, these are the only veins in our body that are actually oxygen-rich. It's because they're coming from that pulmonary circuit. Now, these pulmonary veins are going to bring blood to the left atrium, and it's at the left atrium where blood is now going to move past another AV valve called the mitral valve. It's a bicuspid valve. So I've got my tricuspid valve over here, my bicuspid valve over here. This is referred to, though, as the mitral valve. We'll use both terms on the test. And from the left atrium, blood's going to move down to the left ventricle. And again, when the ventricles contract, blood is now going to go up and out the aorta. Now this, again, when the ventricles contract, these AV valves close, forcing the blood to just go up and out the arteries. Now there are valves that exist between the arteries and the two ventricles. Now what's easy about the names of those valve names is they are named based on the arteries that they're attached to. So from the left ventricle, when blood leaves the left ventricle out the aorta, when blood tries to fall back in, these kind of act like little flappy doors. And so this aortic valve is actually going to snap closed if blood now tries to fall back into the ventricle. Now, over on the right ventricle, you can't see it on this diagram, but I already told you, valves are named after the arteries they're attached to. So between my left ventricle and my aorta is the aortic valve. Between my right ventricle and my pulmonary artery is the pulmonary valve. And that's the one that's not pictured here. Here you can actually see some cross sections of these valves. If you dissected the heart perfectly, you can actually see that AV valves are actually built differently than these semilunar valves is what they're referred to. So semilunar valves are the valves that exist between my ventricles and my arteries. AV valves actually have these cords called chordae tendineae that are between the atria and the ventricles that close when the ventricles contract. So here you get an up-close picture of a heart that's dissected, and you can actually see it a little bit more on just the different structure of my semilunar valves versus my AV valves. So here's another diagram just to help you understand just this constant continuous flow from the systemic circuit. And that's what I'm seeing here is my systemic circuit of the body down here. And then I'm seeing my pulmonary circuit on the side with my lungs. So this gives you a better idea of lungs and body circulation, but it's still the same heart diagram, except here with the heart diagram, they are showing you the pulmonary valve and the aortic valve. But you can see this flow from the body. Oxygen poor blood is coming through the vena cava to the right atrium, now to the right ventricle, up, out through the pulmonary valve, out through the pulmonary artery, picks up oxygen. It's going to return through the pulmonary vein. The pulmonary vein is bringing this oxygen-rich blood to the left atria. It's going to pass down through the mitral valve. The left ventricle is going to contract, and this oxygen-rich blood is going to pass through the aortic valve and out to the body to now deliver oxygen to the body. So make sure you know that blood flow through the heart. Here's a diagram here that's actually helping you understand how the coronary artery, the artery that is actually going to be delivering nutrients and oxygen to the cardiac muscle, actually right after the aortic valve, there is a little opening. And this is oxygen-rich blood coming directly from the aorta to that coronary artery to fuel the heart. Here you can actually see the outside of the heart, and you can see this coronary artery that is actually extending out. And also with a real heart, hearts actually do have this fat that is embedded around them. And we'll actually talk about coronary artery disease. Coronary artery disease is what causes a high majority of heart attacks in individuals is when this coronary artery starts getting blocked with plaque due to atherosclerosis, and we get limited blood supply that is now getting to the heart. Now, what this diagram is trying to help us understand is this blood flow and how valves are involved in making sure that blood is constantly just moving one direction through the heart and through the whole cardiovascular system. So here what we're seeing is with the cardiac cycle. So the cardiac cycle, for your heart to beat, and you guys have heard heartbeat, it's a lub-dub sound, lub-dub, lub-dub. It's a two-beat system. Well, what's actually happening is both atria contract at the same time, and then there's a slight delay, and then I have ventricles that both contract then at the same time to push blood out through the arteries. And then there's a pause, and then I get atria contract, followed by ventricles contract, and a pause. Now, what is happening in this, when atria contract, they're going to push blood down into the ventricles, and then ventricles are going to be contracting, pushing blood out the arteries. But when those ventricles contract, they snap these AV valves closed. And that's actually the heart sound that you hear is you are hearing valves closing. You're not actually hearing the blood moving. If you're hearing blood moving, probably going through the valves backwards, and that is actually what a heart murmur is, which is no bueno. But you are actually hearing, when you hear a heartbeat sound, you are hearing valves closing. So actually that first beat you hear are AV valves snapping closed. The second part of the heartbeat then are these semilunar valves that are actually closing, is what you end up hearing. Now, when the heart contracts and when blood is actually leaving, let's actually, here's actually the heartbeat sound here. When the heart is contracting, it's actually under a tremendous amount of pressure. And so that is what we refer to when we talk about high pressures and high force. This is what is referred to as systole. So atrial systole, ventricular systole. So this is under the highest pressure is what we're actually talking about. And then diastole is now that relaxed state. So when you hear those terms, we'll talk about it in blood pressure, the systolic pressure, the diastolic pressure. That's going to be the highest pressure versus the lowest pressure that your arteries are under. Now, in this particular diagram, I'm trying to show you the volume of blood that's in the ventricles. You don't need to know that. You will, though, have to be able to read an ECG. So this is from a heart monitor. If somebody is having their heart monitored, they have an electrocardiogram that is placed in order to be able to determine how the atria and the ventricles are contracting and relaxing or repolarizing. what these are actually noting is depolarization events in the atria and the ventricles, and then the repolarization. When we talked about the nervous system, when we talked about action potentials and depolarizing of the cell and then repolarizing of the neuron, really it's the same thing that's happening in the heart, but it has to be a coordinated event in order to make sure the atria contract first, ventricles contract second. So with these action potentials, we actually have a node of neuron fibers here that are the pacemaker. These control the heartbeat. We have to know that this is referred to right up here as the SA node. The SA node is your pacemaker. This is an artificial pacemaker. So if somebody does not have the ability to regulate their change in heart rate due to activity, and it's actually not necessarily due to activity, what it's actually detecting is acid levels. So when the blood becomes more acidic because carbon dioxide is building up in the blood, that actually triggers your heart to start increasing blood pressure. We actually don't have monitors for oxygen level in our body. We have monitors for pH and carbon dioxide buildup. If you're not able to get rid of that carbon dioxide, it actually now turns your blood more acidic, and that's what ends up speeding up the heart rate. So we have this SA node here that is receiving a signal from part of your brain, the medulla oblongata, in order to go, oh, speed up the heart rate. So this SA node sets the pace, and it sends out through these neuron cardiac muscle hybrids called Purkinje fibers, named after, I'm sure, the good Dr. Purkinje. So these are actually going to coordinate atria contracting first. Then that relays the signal to this AV node, and the AV node's job is now to send the signal through these Purkinje fibers, so down this septum, this middle of the right and the left side, and it's actually going to force this contraction of the heart from the ventricles bottom up in order to now push that blood up and out through the arteries. So what are we looking at here? I am looking at an artery. So with this is the cross section of an artery, and this is the lumen of the artery. And with the lumen is that open space, so that hollow tube that blood would be flowing through. Now, we know that there is smooth muscle that lines arteries. It is very important that our blood vessels have smooth muscle in order to be able to help monitor blood pressure, help monitor blood flow that is coming through. So you're seeing a lot of smooth muscle in these artery walls, plus you've got your endothelial tissue that is here, it's other connective tissue. Well, unfortunately, what happens in a signal of heart disease is cholesterol, high blood pressure starts leading to this plaque buildup, and this plaque buildup is where series of chemical events have happened where through this, we're getting this cholesterol that now turns into this hardened, like yellowy plaque material that actually hardens the arteries, narrows that lumen, and actually makes it very difficult for blood to flow through those spaces. So this is a disorder that we refer to as atherosclerosis, that hardening of the arteries that's also going to lead to higher blood pressure. Now, we will do an activity where you guys are taking blood pressure. You will also do an activity where you look at cholesterol levels and make sure you understand different cholesterol levels. But for this diagram, it's important that you understand just the basics of an ECG and what these waves are showing you. You guys have all seen this. You all watch shows with doctors on them, and you're always seeing this bloop, bloop, bloop. Now, with this, you do not need to know it as the P, Q, R, S, and T wave. You just need to know this one cardiac cycle and recognize what we're seeing. The first wave, this is atria contracting. So if this is the atria contracting, remember atria are smaller, they're thinner walls, there's not as much cardiac muscle here. So this is the depolarization that's happening. And then what you're seeing in this big wave here, this big peak, this is actually now the ventricles contracting is what we are seeing. Ventricles, there's tons of cardiac muscle tissue there. There's lots and lots of tissue that's going to be depolarizing. So the ECG picks up that event in this really strong peak. Now, what's happening here, because atria have to depolarize, but what the ECG can also pick up is repolarization. But the repolarization of the atria is actually happening at the same time the ventricles are depolarizing. So we don't see a wave for atria repolarizing. But what we do see, so I see atria contract, ventricles contract, but then what I see is ventricles repolarizing. And then it's going to happen again. I'm going to see atria contract, ventricles go back to normal. Atria contract, ventricles go back to normal. Pause. And so that's what I should be seeing in this ECG. You guys are going to be doing an activity where you actually look at some different ECGs that are kind of not following a normal pattern in order to be able to determine maybe what are some of those causes of this irregular ECG. In looking at these two pictures of blood vessels, on your test, you're going to have unlabeled blood vessels. And what you should be able to quickly determine is that this is an artery and this is a vein. Even though they're the exact same size on the outside, you should be able to look and understand that my arteries are very thick-walled and my arteries don't have valves in them. Because arteries are carrying blood away from the heart, they're under a tremendous amount of pressure. Therefore, they need to be thicker walled. They also need to be able to help monitor blood pressure. We measure blood pressure through arteries. They need a lot of smooth muscle in here in order to be able to relax, contract, adjust your blood pressure too. Veins are under a very, very low pressure, almost no pressure at all by the time the blood gets from the vena cava to the heart. So in order to make sure through veins, since they're under so low of pressure, make sure the blood is only going one direction. Veins have valves in them. And that's what you're seeing here are valves going through the veins. And also veins don't need to have as thick of a smooth muscle wall as well. So you should be able to easily look and go, oh, this one has valves, therefore it's a vein. It has thin walls versus this one with thick walls with no valves. Artery versus vein should be easy to determine. Now here, even in capillaries, you guys know that your capillary beds, and you do not want all of your capillary beds to open up all at one time. That would actually drop your blood pressure way too low, which could be deadly if now we actually even increase the permeability of these as well. Our capillaries have little sphincters, little smooth muscle on them so they can open up and close in order to increase and decrease blood flow through those capillaries. You guys know your face does not always beat red, but when you start exercising, we start increasing blood flow to the surface of your skin. We start opening up some of these precapillary sphincters in order to turn the faucet on and let blood flow through those capillaries. Here we can see through a capillary, this is actually where there is surrounding fluid that actually has to leak out and has to leak out through those capillaries in order to get that surrounding, sort of get that plasma that is nutrient rich out to surrounding tissue. We need oxygen to be able to diffuse from the red blood cells. The purpose of your capillaries is to make sure that your red blood cells stay in here, but we allow the plasma to get out and bathe the surrounding cells with their nutrients. It's pretty cool diagram here, just showing you this flow. And so one of the things you should be able to address is which direction in this picture would blood be flowing? Would it be flowing up or would blood be flowing down? And you should be able to look and go, oh, blood always goes from an artery to the capillaries to the veins. So blood would be flowing down in this case. Here we're actually seeing valves. But when we do talk about pressure in arteries versus veins, we do need to recognize the condition called hypertension, high blood pressure. And hypertension is brutal on the body. And it's very, very important that everybody knows how to monitor their blood pressure, understands what normal is. And when your blood pressure starts becoming normally above 120/80, this actually leads to long-term damage to all sorts of tissues throughout your body, and understand the reasons why. Now, high blood pressure, some of the things high blood pressure can lead to are aneurysms and strokes. If somebody has an aneurysm, it means that an artery has ruptured in some way. So it's ruptured or it's bubbled out because the walls weren't thick enough to handle that pressure. Also, hypertension over time can lead to this atherosclerosis, this hardening, and that could actually trigger a clotting event too that now blocks an artery. So if we're blocking a major artery, that's a stroke. And that stroke inside the brain is going to decrease now blood flow to certain regions of the brain and potentially killing that tissue. You will, in your activities, look at different treatments. So here's my blockage, this cholesterol blockage, this atherosclerosis. And this is actually showing you a procedure when this blockage gets too bad. Well, now what needs to happen is doctors need to go in and do an angioplasty. And so that angioplasty is using this mesh wiring to kind of expand that artery in order to allow blood flow to continue through at a normal rate. When there's too much blockage and too much atherosclerosis in coronary arteries, and now they're at high risk of heart attack and an angioplasty can't be done, this is actually when bypass surgery needs to occur. And with a bypass surgery, what's happening when this blockage is actually too much and it's going to be too dangerous to actually try to open this up, what they'll do is take a blood vessel from your leg and they will literally create a bypass around the blockage. So here's my aorta. And instead of using the normal aortic route through the coronary artery, they create a new route that now feeds that coronary artery, but now bypasses this blockage. So we can now get normal blood supply and oxygen supply to that cardiac muscle. Now, what I want to take a look at here is why is high blood pressure? I said that high blood pressure just starts wreaking havoc on your body over time, and it's all tissues of the body. High blood pressure is just something you need to keep in check so you can lead a long, healthy life. And it's all different organs end up taking its toll if you have chronic hypertension or high blood pressure. So let me first of all show you this diagram here that is explaining what I've already said before, which is the amount of blood pressure that is normally in aortas versus now capillaries and veins. So here is from my arteries. So here's my aorta. This is where the highest blood pressure is actually going to exist. Now, blood pressure is reported in a range. It's reported in a range that's the highest pressure that blood is exerting its force on the walls of the vessels. The highest pressure is referred to as the systolic pressure. That's right when the heart is contracting and it's the most blood that's being forced through the arteries at the time. That's going to be my systolic pressure. And then the diastolic pressure is the lowest pressure that your arteries are under. And again, this is the force that the blood is exerting inside the walls of the arteries against those outer walls. Now, your blood pressure to be normal should always be less than 120 over 80. 120 over 80 used to be considered normal. This is actually now considered high normal now that we've done more long-term studies on what high blood pressure does to the body. Now, where we take blood pressure, we usually take blood pressure in your brachial artery. So from that brachial artery in the arm, when you do that, that's where the blood pressure is going to be. That's why it should actually read when we're taking that blood pressure, it should be about 110 over 75 is about where a good healthy blood pressure should actually be when you're taking blood pressure with a sphygmomanometer. So you guys are going to read about the sphygmomanometer, one of my favorite words in science as well. Now, with blood pressure, your blood pressure, it actually from arteries gets less and less and less. And at the capillaries, it actually starts out fairly high. And then at the end of the capillaries, well, then it gets to be low. It's important that there is this ideal pressure, the pressure at the beginning of the capillaries in order to force out nutrients and oxygen to surrounding tissue, but it's got to be low enough here so actually, we can recollect that lost fluid and also those waste products from that surrounding tissue, and it can get back into the capillaries. So now that waste can be returned through my veins. Well, here's a diagram here that's trying to show you at the capillaries, trying to show you this ideal pressure where at the beginning, so from that arterial to capillary, I need pressure to push out those nutrients into that surrounding tissue, but I need my pressure to be low enough here that fluids can get back from the surrounding tissue back into my blood. And now that blood with waste can actually be carried out to the venules. If my blood pressure is too high, and at this point, this is way too high, then I'm not going to get any of this waste product or very little of this waste product to come back in. So now what ends up happening is your surrounding cells and your tissues, instead of being bathed constantly with nutrient-rich fluids, they're going to be constantly bathed with this mixture of waste products and nutrients, and they're not going to be able to thrive and replenish themselves as readily as cells that are constantly getting rid of that waste. So again, having ideal blood pressure is important to make sure that your tissues are constantly getting a healthy supply of nutrient-rich plasma and blood, and they're able to get rid of their waste very, very rapidly. Now, blood pressure, one of the things that you should recognize is one of our negative feedback systems that we have is maintaining blood pressure. When you are standing up, your blood vessels actually have to constrict down in your lower extremities to ensure that blood actually gets back up to your heart and gets up to your brain. And how many of you guys have ever gotten up way too fast and then all of a sudden you feel lightheaded, like, ooh, I got to stop here. And then you need to actually adjust. This is referred to as my baroreceptor reflex. So when I'm laying down and my heart is on the same plane as the rest of my body, well, now I can actually relax my blood vessels and I can have adequate blood pressure in order to make sure all of my systemic system gets adequate supplies of blood. But then when I stand up, I'm going to have this baroreceptor reflex now start contracting arteries and veins in different parts of my body to ensure now that I have balanced blood pressure, to ensure that I'm getting plenty of oxygen rich blood to my brain, to my upper extremities as well. So this is a term that you guys are going to see too of what baroreceptors are. And so that baroreceptor reflex is that constant change in constriction and relaxation of blood vessels. Now, when we do talk about the smooth muscle is actually one of the reasons too. So one of the things you guys will have to look up is just some of these common arteries and some of these common veins that you guys should know. Like everybody should know their carotid artery. So when you are feeling for your pulse here on the side of your neck, you are feeling your carotid artery. This is the major artery that's taking blood up to your brain. But some of the things you guys should know that, again, with a baroreceptor reflex, high blood pressure, nicotine. Nicotine is a stimulant, and what nicotine as a stimulant does is it stimulates smooth muscle to contract these blood vessels, and it elevates your blood pressure. If you are somebody or somebody in your family has high blood pressure, one of the things they need to do is stop smoking if they do. And then the next thing to do is try to relax a little bit more, and then also because that's sometimes that stress, that adrenaline starts increasing blood pressure and that contraction of arteries. But then also decrease your salt level, because when we have higher amounts of salt in our system, that means that your blood volume has to have more water to dilute that salt, and that higher blood volume also will exert more pressure on the arterial walls. So with this particular chapter, a lot of information, but blood flow through the heart, absolutely really important that you make sure that you understand. The activities are going to help you to decipher a little bit more about blood flow through the heart, and also then some healthy choices, how to monitor your blood pressure, and then also making sure that we are understanding why maintaining proper heart health and different easy steps can be taken in order to ensure that you are not one of those statistics of people who died due to heart disease. So with that, I missed you guys. Hopefully I get to see you all soon and hope you guys are all doing well. Number one thing you can do, exercise. Exercise, exercise, exercise. Get outdoors. That's actually going to decrease your blood pressure and lead to a healthier cardiovascular system. You're welcome. Goodbye. Maybe. Come on, Shelton. I gotta stop sharing. I hit the wrong button.